Well, I guess that's my cue to get started. Hello, everybody. Good morning to everyone in the Northern Hemisphere, and good evening to all of my colleagues here in the Southern Hemisphere, who I've now spent most of the day with in a various ways. Um, Hello to everybody, and a huge welcome to this first International Community of Practice for Person-Centered Practice Symposium, the first of its kind that we have delivered, and the first time for us to do something simultaneously, or should I say successionally, from the Southern Hemisphere through to the Northern Hemisphere over a 24-hour period. As Webb helped us in a huge way to organize today, I'm sure he totally understands the challenges of making this happen. And we are so grateful to him here in Sydney and to Shima in Ireland, who is making all of this work. So for those of you who don't know me, I'm Professor Brendan McCormack, and I'm head of school and dean at the Susan Wakel School of Nursing and Midwifery at the University of Sydney. And I'm one of the directors of the Person-Centered Practice International Community of Practice that is hosting this 24-hour symposium. And before I go any further, as is our custom here in Australia, I would like to acknowledge the traditional owners of all lands wherever we are in the world. It doesn't matter where we are in the world, we are standing on the traditional owners' lands. People for thousands of years who have come before us, who have made these lands what they are today, and who have given us the privilege to occupy these lands at this time. And these original peoples have been generating and sharing knowledge through storytelling and through arts and creativity for thousands of years. And in that tradition, we carry that on through this symposium and the work of the International Community of Practice. And I'm honored to be alongside some real leaders in that space here in Australia and also around the world. So welcome everybody to this unique online event. I'm really just here to be the continuity speaker between Australia and New Zealand and the Northern Hemisphere. Today we had an amazing program with speakers from around Australia and New Zealand, really elevating the significance and importance of person-centeredness in healthcare and generally in how we look at the way we connect with other people. And I've no doubt that that same conversation is going to carry on in the program that is happening here today. The program is specifically designed so that it gives space for people to converse with each other, to engage, to discuss, and to really think critically about the kinds of issues that underpin person-centeredness in all its various forms. We don't have really a lot of time to engage in introductions with each other, but I have noted that most people on this webinar have been introducing themselves to each other in the chat, and I would encourage you to continue to do that and to connect with each other as you go through the day. As in the spirit of that conversation and with engaging with each other, we also have a Padlet that is live, which will become alive really around lunchtime with some critical questions that we would like you to connect with to really carry on this conversation beyond the symposium itself. And the link to the Padlet will be provided to you in the chat and with some key questions that we would like your response to. In whatever way you want to do that, some experiences, some stories, and just some clear responses to the questions that we're asking. So it is my privilege to introduce this symposium and also to, I think I'm introducing our first speaker. So Professor Tanya McCance is my long-term partner in crime when it comes to person-centered practice and person-centered research and person-centered development. Tanya and I have been engaged in this work for, dare I say, 24 years now, and have been working together in this collaborative, inclusive relationship for 24 years. Going on for more now, and we're still friends. That's an amazing achievement in itself. So both Tanya and I have developed the presentation that Tanya is about to deliver, and this morning I engaged with it in the Southern Hemisphere and had a great conversation about the issues that's raised. And Tanya is going to put our own particular taste to this presentation. So even though it's shared, we know we don't share the one brain, that we do have our own perspectives on the world and do have our own unique perspectives on person-centeredness that we are very happy to discuss and very happy to work with. I do also at this point want to say that unfortunately and sadly, I'm not going to be able to stay for this whole event. I am the continuity speaker, as I said, because I've got a 5 a.m. start and need to get my head into that space as well. But I know it's going to be an amazing day. And I do want to thank all of the colleagues who have worked together, both in the Southern Hemisphere and Northern Hemisphere, to make this event happen and to get it to work in the way that it has. And I'm truly grateful on behalf of all our colleagues to everyone who has done that. So without further ado, without stealing any more thunder, I do want to hand over to Tanya, and I know you're going to have an amazing conversation with her. So Tanya, over to you.
Thank you very much, Brendan, for that warm welcome. Like Brendan, I'm really excited to be part of this kind of really quite seminal event that we hope will be the start of very important conversations to come. The theme of our session, when we put out the advertisement, was about shining a light on person-centered healthcare. And we want to do that, as Brendan has mentioned. We've been working in this space for 24 plus years. And I suppose we want to be a little bit provocative today. And we want to encourage everyone online today to be a little bit courageous and engage in some of the issues that we are going to present in terms of how we're trying to continue to move forward with this agenda. So be courageous, keep your video on, don't be afraid to speak up, because I believe that if you're on this line, we are all like-minded individuals trying to make a difference in the space that we occupy. So I hope what I'll do in the next 20 minutes, no more than 20 minutes, is just to provide some hooks. They'll already feel familiar, but provide some hooks to get the conversation going, and we hope it will flow throughout the day. I'm only going to speak for 20 minutes, but my slot is 45 minutes because we want to leave lots of space for engagement and stories and comments and supportive challenge, because that's how we grow and how we develop. So without further ado, I will make a start. So here's hoping the technology works. Yay, it does. Okay, so this is a slide Brendan and I have been using for a number of years, because I think what it does, it shows the momentum that person-centeredness is gaining across healthcare systems globally. And, you know, when we think about why has it gained such momentum, I don't think it takes a rocket scientist to work it out. So we see the deficiencies in our systems, in our healthcare systems. We see still a massive reliance on the biomedical model. We see healthcare practices that privilege tradition. For example, a focus on task. We also see how practices dominate sometimes the way we interact with patients, clients, families, and each other. So these kind of traditional practices are driving our healthcare in a direction that actually doesn't recognize that we're all humans, human beings within any healthcare system that we need to be able to connect with. So no surprise that it's become a bit of a global movement. And here are just some of the offerings that are out there. And I suppose the point I want to make about this slide is we are 20 plus years on a journey around bringing person-centeredness, making it a reality in our healthcare systems, but there is a massive growing evidence base. So in some respects, we sit here today knowing some of what works, understanding some of what doesn't work, but knowing we have more to explore if we're really going to make person-centeredness sustainable across our healthcare systems. And I use the word systems, and you'll hear it throughout my presentation, because this is where it's at. If we're really going to bring about the change that I can say I'm absolutely passionate about, we have got to think about systems. And I'll pick that up as I go. So just as a refresh, because I know everyone on this line will know this well. So the whole kind of fundamental concept that underpins this work is the notion of personhood, okay? And we need to, in our healthcare systems, respect the personhood of all persons. And whenever we discuss personhood in the work that Brendan and I have done, we talk about personhood in the context of 5 modes of being. Being with self, being in relation, being in the social world, being in place, and being in time. Now, I'm not going to go into each of those in detail, but the kind of crux of those modes of being and understanding those modes of being is that it is through engagement with the 5 modes of being that we are in a state of being and becoming and continually transforming in terms of both developed and developing persons. So engaging in those modes of being reflexively is really important in terms of our own personhood and who we are as persons. But outside this outer ring that encapsulates those 5 modes of being is a recognition that actually in the systems that we work, there needs to be a kind of a foundation of a broader set of values that support our ways of being. And that is about maximizing respect. It's about maximizing trust. It's about enabling self-determination. And it's actually about maximizing autonomy. So these are really important broader values that healthcare systems need to be able to demonstrate if we are enabled to really continue our ways of being as persons. So I know it's a bit philosophical, and I make no apology for that, because this is where it starts. So whenever we think about values, that's where it begins and ends, and I'll talk a little bit more about that as we go through. So whenever we think about those broader set of values, that's what creates our person-centered practice culture. And in the work that we have done, we're clear about what we mean about a person-centered workplace culture. And it is about a culture that enables effective practices that enable the formation and fostering of healthful relationships between all persons. And when we talk about healthful, in the work that we do, we're talking about healthful as a means of being able to flourish and reach your full potential. So in the workplace cultures that we describe as person-centered, everyone isn't able to flourish and reach their full potential. And it is then those workplace cultures, in order to bring that about, it is about being explicit about those important values of respect for personhood, self-determination, mutual respect and understanding. Those are the fundamental values that are really critical to bringing about a person-centered practice culture. And interestingly, in terms of our workplace culture, we know that values drive behaviours. And it's interesting, I read some work recently by Brené Brown around vulnerability, and she talks about mind the gap. And this really resonated with me. It was such a simple phrase. And that is whenever our values and our behaviours don't align. And you know, the actual crux of it is right there, is about understanding that what do we need to do when the values we talk about are not aligned to our behaviours, this notion of mind the gap. And in terms of how we bring about change, we have to challenge the norms and those traditional practices. And it's interesting, this is a quote from a lovely book. It's How to Be More Parrot. It's about leadership. And you're going to hear a little bit more about leadership from one of our experts, Sean Cardiff, later on this morning. But he coins this phrase: there's only one thing more stupid than stupid rules, and that's the people who follow them. And it is a real challenge whenever we are in cultures where the way things are done around here is so powerful. But it is about how we recognize the gap, and we work out ways to how we can close that gap, how we can align values to the behaviours that represent and demonstrate person-centeredness. And hence that brings me to focus on the framework, the person-centered practice framework. The framework was developed right in that context. We recognised that in order to see there was even a gap that existed, and then work to try and close that gap around values and behaviours, that we actually needed to understand what we were talking about when we talk about person-centeredness. And right back at the beginning, when Brendan and I were working together to develop person-centered nursing, we realised within our own small team right at the beginning that there wasn't really a very clear shared understanding about what we meant by person-centeredness. And that was the birth of the person-centered nursing framework, then to lead to the involvement of the person-centered practice framework. So we, in a very simple kind of way, we offer the framework as a means to operationalise person-centered practice in any healthcare environment. So it brings a language and a clarity to what we talk about when we talk about person-centeredness. Now, I'm not going to go into the details of the framework. I would imagine many of you on this line are very familiar with the framework. And those of you who maybe are less familiar, this is our most recent text on this slide. It's the fundamentals of person-centered healthcare practice. And if you want to read more about the framework, this is a good reference book to access. It's a co-edited book, international co-writers right throughout the chapters. And it's a really excellent dip in, dip out book to try and start to get you on that journey around understanding person-centered practice. So in terms of the framework, first originally published in the Journal of Advanced Nursing in 2006, right up to this latest publication now, 2021. And Brendan and I are now, right now as we speak, in the process of developing our third edition of our own book. But all over those years, when we originally developed it, we had no sense whether it would have any traction at all. But it has gained incredible momentum globally. And I think what I often say, what I believe is unique about the framework is not its content. Because if you look at components of the framework and you're a practitioner at your heart, you will understand very clearly. You will know, oh, of course, oh yes, oh, of course. There will be a familiarity with the components. I think what's unique about the framework is how we've brought it together. The relationships between those elements. So I suppose the point I'm making is the whole is greater than the sum of the parts, is how I would describe the person-centered practice framework. And you can use it in many, many different ways. A tool for reflection. You can use it to engage in a critical conversation. You can use it to underpin a quality improvement project. You can use it to drive theoretical developments. There's lots of different ways we have used this framework. And I suppose I encourage you to think about how you might engage with the framework as a way to bring a clarity to the whole concept of person-centeredness. And indeed, the person-centered framework has been at the heart of some of the impact we've been able to demonstrate. These are just a kind of a taster of some of the impact that we've had ourselves, along with our international partners across the world. So please do not think for 1 minute. Brendan and I have done some work in our own specific area, but it's the work of our colleagues that has led to the growing evidence base that I referenced earlier. So just a few examples I'm going to pull out of this slide around impact. So it's been translated into 14 languages, and I think that is a testament to its applicability across multiple contexts. We also have a whole suite of associated instruments that allow us to measure components of the person-centered practice framework. And we've used those in lots of different ways. And actually we get numerous emerging students, academics, researchers emailing us saying, can we use your framework? And of course, you know, it's out there for use in all its forms. We've been able to demonstrate impact in particular clinical contexts. Brendan has led some amazing work around aged care, and some of the studies he has undertaken in that space has been able to evidence improvements, particularly in relation to resident satisfaction and improved staff wellbeing. We've done some studies in acute care, and that's probably been where I have done quite a bit of work. And we see that when we work in person-centered ways, we get better engagement between staff and patients. We've done some work in palliative care, and again, you can see there we've been able to evidence improvements around staff communication, increased staff development, better retention of staff. We've also undertaken some intervention studies. I think this is the area we need a little bit more work on, maybe look into the future. So you might think about that as we go through our presentation today. I think we do need to understand more the interrelationships, what works for him in what circumstance and why. And I think and we've got quite a bit of insight, but I think that's definitely where more work needs to be done. More recently, we've done some amazing work around curriculum development, and you'll hear Professor Neil Cook from my university talk about work that we have undertaken in an Erasmus Plus project, and lots of our partners are online also today. So you'll hear a little bit about person-centeredness in the curriculum and what can be done in that space. And then finally, strategy development. We have actually done quite a lot of work in the past around strategy development, but I see a real renewed appetite around strategy development, particularly in the Northern Hemisphere. And I'm wondering, is that about the context we find ourselves in right now, post the pandemic, and also the challenges we are having around the workforce? So just some insights to the impact we've had. However, herein, that's all nice, and I've done a really lovely chat up to now, and now I'm going to get into the thorniness of it all. Because yes, we can demonstrate these impacts, but still, why is person-centeredness still so hard to achieve and sustain in healthcare environments? And I know we would all, if we went round the room, we would have stories, each of us, professional stories, but also personal stories of when we have had people we love in a healthcare system and it hasn't met the mark. And I find myself scratch my head and say, what is the issue? Because it seems so obvious, but yet we can't quite get there. And I think the issue is it's because of the complexity in our healthcare systems, and because everyone in our healthcare systems are human beings. And as human beings, and I think this is the most beautiful quote, and I think it says it all, we're dealing with human beings that are operating on the inside, and we always don't know what's going on the inside. Hence the importance of understanding personhood and our ways of being. So let me talk a little bit then about the challenges that Brendan and I have synthesized together to offer to you today to get the conversation going and seeing what we can do as a movement, a community of practice globally, looking to the future. So these are some of the challenges that we see in our healthcare system, and we've distilled them down to 7 areas I want to just highlight to you today. First of all, problem of language. Secondly, competing concepts and theories, the implicit versus explicit knowledge, obsession with the doing of person-centeredness, lack of coherent strategic and organizational frameworks, evaluation and associated complexity, and sustainability. I'm not going to talk a lot about each of those, I'm just going to give you some hooks that I hope will carry us through the day, and we can pick them up as we hear other speakers. So the first one, problem of language, it is my bugbear, 100%, and it is absolutely still prevailing. So audiences think when you hear person-centeredness, you actually mean patient-centered, or maybe woman-centered, or maybe family-centered. And then what we start is getting a dilution of what it is we actually mean. And what I talk about is white noise. We get a lot of white noise. So I think there's a lot of travel still to be done around our language, and then when we say one thing, we all understand the same thing. So when we say person-centeredness, we know that that actually means those receiving care and those delivering care, and indeed everyone else who's maybe not involved in care delivery but works across our healthcare system. So the issue around person-centeredness is it involves everyone in care delivery, and that is still remains an absolute huge challenge. The second one is about competing concepts and theories. So we find that there is we don't believe we're the only show in town. So the person-centered practice framework is one way to conceptualize and theorize person-centeredness, and we recognize there are others. So we're not suggesting that our way is the only way, but I suppose what we are suggesting is that whatever kind of theoretical perspective you use, that hopefully it will take account of some of these core principles. So human caring, represented by relational ethics embedded in a humanistic tradition, underpins our framework. And it underpins our framework because it is about that notion of being human. So the origins of our framework sit within humanistic principles. So it's about the centrality of a person's beliefs and values, exercising human freedom, commitment to choice and responsibility, practicing holistically through knowing the person, and the importance of time and space. It is also about how we represent the personhood of all persons, and being clear about what personhood means, and the balance and that being and becoming, that we all live in a cycle of being and becoming. We're not the same person today that we'll be tomorrow, nor are we the same person today that we were yesterday. And taking account of a whole systems approach. So whatever theoretical position, what we want to do, what we want to be able to do is to use a theoretical positioning that is applicable in all context, that it takes account of macro, meso, and micro level relevance, clearly articulates individual, group, and organizational responsibilities, and it's amenable to testing. So we're not arguing, as I've said, only show in town, but we know why our framework works in the way it does, and it's because of these core principles. The third one, implicit versus explicit knowledge. So, you know that kind of notion, person-centeredness, but sure, we do that anyway. You know that? We do that anyway. Sure, we already know about that. And actually, I had a lovely example when I was teaching our advanced nurse practitioners a number of years back, less so now. I think the penny has dropped. And they kind of said, why are we doing this? Person-centered, we know what that is. But actually, what they were talking about was patient-centeredness and how they deliver expert clinical care. So when we started to unravel it with them, it was like, oh my goodness, this is much, much more than I thought it was about. Because it isn't just about person-centered care, it's about person-centered practice. And that brings into account culture. Because as I've already said, culture is everything. And that is about how we engage everyone involved in healthcare delivery to bring about workplace cultures that are healthful. So very challenging. This one is very challenging because you've got to encourage people to actually be open-minded and explore their understanding as it stands today, and try to move them to a position where they get that it is about a systems-wide lens that you need to bring onto this. And then the obsession with doing of person-centeredness. I think people on the line will understand what I mean by this. This is the whole area of we don't have time to be doing that stuff. We don't have time to do person-centeredness. And it also links to, sadly, our reversion back to a task-oriented approach to care. And I'm sure everyone on this line will have a story about how we see in our clinical environments that the focus is often on task. And that brings me back to our context, workforce issues, shortage of staff, not always appropriate skill mix, all of the elements in the practice environment in the framework that we're struggling with. However, one of the things that I often talk about when I talk to groups is very simply, if you take one thing away from anything I say, it is this: person-centeredness is a way of being. It's a way of being in the doing, but it is a way of being first and foremost. And my little daughter, I tell everybody, I'm so proud, is her second year nursing student. And I talked to Melissa, she is already overwhelmed and challenged by the system and what it feels like. And I say to her, you have a personal choice how you wish to engage. Doesn't matter about the system, doesn't matter about your team. You can choose how you engage with that person in that moment. That is your choice. Nobody can take that choice away. So it's trying to bring that sense of control back to our individual practitioners, our teams, and to our systems, that if it's a way of being, you have got time, you can take control. And in some of the work that we have done in the past, some research work, we have found that it is that constant tussle in the daily grind of everyday practice. And that whilst practitioners absolutely have the desire to live out person-centered values, it's the challenges of everyday practice that can sometimes get in the way. And what we get as a result of that are person-centered moments versus consistent person-centered care. That's how it plays out. So I think this is a really important element. I did a session a couple of days ago with some nurses from the independent sector, and that was their take-home message, that actually it isn't about the task. It's a way of being in the doing. So nearly there. So the final, lack of strategic and organizational frameworks, simple message here. I think in a lot of the work that we have done in the past, we have used a practice development approach, which has been incredibly powerful. But there now, Brendan and I have started to engage in conversations and in work about how we bring the same commitment at all levels of an organization. So I think there has been a focus on the micro level, point of care in some of the work that we've done, without always taking account of what needs to happen right through an organization or right across the system. Hence the reason why I think there's such an increased and re-emerging appetite to look at how person-centeredness can underpin strategy and policy. And then it starts to kind of tease out what are the responsibilities at different levels in an organization: exec team, director of nursing, etc. So I think this is an exciting space, and we would like to do work with the international community of practice around how we bring some more robustness to developing organizational frameworks that allow this way of being to flourish across our healthcare systems. And then finally, and that's just a comment that we have at the very last chapter of our fundamentals book. You know, in the end of the fundamentals book, we all kind of scratched our head and said, what now? And this is our call to action. And it is about the sustainability of person-centered care is dependent on the existence of person-centered cultures. And without this, it remains an elusive ideal that is fragile and transient in nature. And that means it can't just be an individual practitioner's responsibility. They can focus on the being person-centered, but there has to be organizational frameworks and infrastructure that make those decisions so easy to make, so easy at any point in time. And then my final comment is about evaluation and associated complexity. So you've heard me talk about person-centeredness and the actual core components of it. So no surprise that actually when we come to evaluate, measure, evaluate, it is challenging. And we know in the work that we do that we need to embrace theory-driven evaluation that encompasses mixed methodologies and captures the diversity of experience among all our stakeholders. So there's no surprise that you see a lot of our work has been using participatory methodologies. And that's not surprising. However, we have a challenge in terms of demonstrating impact, large scale impact. And again, that's something for us to think about the future. You know, we, Brendan and I, often on those nights where we're sitting, chewing the cud with a glass of wine, talking about that one big large scale randomized controlled trial. Will we ever get there, to really show that the things we've talked about today, when they are introduced systematically and methodically, they make a difference. So it's that element. that I think, you know, we need to think about also looking to the future. And finally, sustainability. Well, I'm sure we all have our stories about sustainability. My painful stories are always take anybody out of the context, and they've done great work, wonderful work, super good, and then in a short period of time, it seems to have disappeared, evaporated into the ether. So we need to think about sustainability, and I think again that is about bringing a whole systems approach to what it is we're doing. Because if we just do it if we fragment it in our organizations, we will not have sustainability. So it kind of flicks back to the whole, you know, the strategic and organizational frameworks also. And again, our work with Erasmus is a beautiful example of where we try to bring a whole systems focus to implementation and sustainability with person-centered to the curriculum. And it's actually building on this work that Brendan and I would love to see. What would we need to do differently to bring something similar to healthcare organizations, and building on this excellent work. And again, Neil Cook will chat about this a little later this morning. So I suppose I leave you with this question. Then we're going to open it up for some discussion and comment. And I suppose it's that question, you know, what imprint do you want to leave on those with whom you connect? You know, what difference do you want to make? What do you want to be known for as you move through your practice? So I'm going to stop talking, and I'm going to hand back to Sean, who's our amazing facilitator for the morning, Dr. Sean Cardiff. So thank you for your attention, and I hope I've set up the day in a helpful way to encourage those courageous conversations.
Thank you, Tanya. I can imagine that quite a few people here in the room, in the virtual room, are thinking, oh, question. So maybe take 30 seconds to jot down some keywords that kind of been hanging around in your mind while you've been listening to this. And then after 30 seconds, maybe you've a question that you really want to pose. Or you may already have one that's like hanging on the tip on your lips and you just need to get it out. Please do it in the chat or open your microphone and ask Tanya. She's a good listener, as I know from experience.
Yeah, I have one, if that's okay with everyone. Thank you so much for the presentation. There's a lot to unpack in it. Of course, there's so much information that is in these slides. I often think about India, where I come from, and how healthcare practice works there. It has changed over the course of time, and there's a change in culture where it has almost become less person-centered as time has progressed. So thinking about cultures or political beliefs or religious beliefs where person-centeredness is in direct conflict with people's state of being, what solutions would you propose to bring person-centered principles into?
Well, I mean, I think that's everything we've talked about, and it's interesting. Hannah put a comment in the chat room, and I think this is maybe actually quite a good response, Webb, to your question. Thinking of doing, and we don't have time. I guess from our health economic studies, we can say that this probably doesn't take much extra time, but it takes a bit for getting started or rethinking. So if you're completely swamped, I guess it's not easy to do it without any additional space. So I think that is exactly it. I think we have persons in our healthcare system who recognise the changing landscape around equality and diversity and human rights. But sometimes in our systems, we just get caught up in the doing. We just get caught up in the doing. So, and my answer, Web, is I think we need to come at it from lots of different levels, and there's not going to be any surprise that I said that. I think there's work to be done at team level. I think there's work to be done at organizational level, but I think there's work to be done in the macro context. And I think some of our policy and strategic frameworks aren't actually conducive. And indeed, if you think about our current situation, and I'm going to talk about Northern Ireland, we didn't have a government in power for the last, oh my, I lost count, I think it was about 2.5 years. That's very, very challenged to bring about those changes in the macro, the political and strategic landscape that are required to enable people to understand with clarity and to work in a different way. It's very challenging, but I suppose I would finish by saying, as an individual, if you subscribe to those principles, you should be enacting those out in your way of being. Thanks, Web. I hope that's helpful. Would somebody else like to come in? Would Hannah like to come in on that? She's made a really lovely comment in the chat.
Well, we are doing quite a lot of research in this health economics part, and I'm aware that most are not so involved in that kind of research. So we are actually we are really trying to see where are these resources needed during that implementation phase, and trying to get a little bit more of insight in that part as well. But it's not always easy to study, of course, and but I hope it will. I hope it will help this process of implementing in the future, at least.
Thank you, Hannah.
Maybe adding something into the mix. I was struck when at one stage you were talking about interventions, and we need to be looking at interventions from a person-centered perspective. And then there were the principles. And I was wondering if anyone's got an example of an intervention that they consider person-centered, and whether they can align that alongside the principles, or use the principles to illustrate why their intervention is person-centered. Anybody want to take up that? I don't know. There's Mariah. Your hand is there.
Hi, Sean. Probably not. My hand wasn't up necessarily for that. Margaret was before me. So, Margaret, I'm just going to ask a quick question before you get in there. I actually wanted to expand a little bit on what Webb was talking about and thinking about, and I suppose this is about being provocative. And so if we think about healthcare as being a white privileged construct, person-centeredness has been built within that. And I think, you know, Brendan and Royanne are doing work around how you might deconstruct that tenure. And and so building on what Webb was saying about sort of his perspective from India, would be that part of how can person-centeredness challenge the privilege that exists in healthcare, and so the discrimination that comes from that, not just for Australia but for many countries. And I think that's what I took from Webb's point. And I might have misinterpreted his point, but I think it's a really relevant point, and I think there is some really exciting work starting to be done in that space. But be interested to hear your views, because each culture obviously has got its own perspective on that as well.
I'll just respond. I'm going to respond to both, but Maria, absolutely. I'm really excited about the work that Brendan and Rhiannon are doing around the Indigenous work that they're undertaking, and I've been involved in part of that. And I think we would accept that actually there is a limitation to our work in that it has been largely developed within, exactly as you say, kind of Western civilized, third privileged countries. So I think we are, there is absolutely a lot of work to be done to take it more globally. So I'm excited about to see that work happening. And I suppose the crux of it is that we all are uniquely our own person, and in those stories we have to understand what are people's unique life history and life experiences that bring them to this present day. And we do need to develop frameworks that allow us to, I suppose, a wee bit like Sean's point, to take it from a level of principle to a position where it is, you know, tangible across very different populations. So I think this is work. Exciting to see it starting, but we definitely need to do more work in this space.
And maybe we can give Margaret a bit of room. I don't know whether she's going to add on to that.
I see Hannah has come in with examples of interventions, Sean. My point goes to someplace else, I think. So Hannah, if you want to talk about the interventions you're doing first, that's fine.
I don't think I need to say anything. I put in a reference there if to read more, but we of course we have a lot of intervention studies, and we are describing the interventions in the studies, or anyone can contact me if you want more information, of course.
Thanks, Hannah. So will I ask, or I don't know if it's a comment or a question that I have, but Tanya, thank you for provoking my thinking in relation to all of this. So I work in one of these privileged societies, in one of these privileged countries, and talking about the global movement, and I was with you there on the global movement, and then I'm thinking, and I've been thinking that maybe in where I am, person-centeredness has regressed after the pandemic in particular, for all sorts of reasons. There seems to be a quietness around all of that at the moment. What we are very focused on at the moment is that idea of systems thinking, and we're looking at it from a human factors ergonomics. That's the framework that we're using to think about that. And I love this question that's on the screen right now. What imprint do I want to leave on those with whom I connect? So in looking at the system that we're working in right now, we're really coming away from the idea of each individual person being responsible for the environment that the choice that they have about how they want to work, and the onus that's on the system to provide a system that's going to enable them to work in what should be a person-centered way. We don't use the language of person-centeredness in relation to it. So there is that gap between onus on the individual person and then on the system, and the need for the people who design, and design is a big topic of conversation at the moment with us, designing a system that's going to enable people to optimize the work that's done. As I say, we don't use the language of person-centeredness, and that for me, that answers the question about what imprint do I want to leave, and it's so that we design and support a system that enables person-centeredness and bring that conversation to the strategic level of designing a system. Because I think there's a huge amount of work to be done at that strategic level. And I know that there's topics during the day that are going to shed some light on all of that for us. I hope that makes sense.
If I could just respond, Sean, to Margaret. Margaret, absolutely right. And designing systems also take account of our physical environments. We know that we're moving certainly in the UK, and probably a little bit in Europe also, to 100% single room environments. So any new builds are 100% single room environments. I undertook with one of my PhD students looking at the impact of 100% single room environments on person-centered practice. And it was really significant, both for patients and families and for staff trying to organise care. So absolutely, I think this needs to be built into system design in all its glory.
Yeah,
absolutely.
Yeah.
Thank you. I just want to kind of give everyone some opportunity, because there's a lot that could be covered, because Tanya did cover a lot. And Philippa Ventura, I think she's from Portugal by the looks of things. If you want to pose any questions, feel free.
Thank you, Sean. I was picking up on your challenge of identifying an intervention and trying to bring to surface the principles, the person-centeredness principles attached to it. And along the conversation and with the presentation from Tanya, and thank you for the presentation. It's really good to, just to bring alive all the concepts and put us into reflection. We don't get to reflect that much nowadays, always running from one side to the other. So what I was thinking, and in the work that we are developing within oncology nursing, we aim to bring forward a person in relation to symptoms, because it's always this challenge of the objective measures of the disease and the illness, right? And the experience of those objective measures. And here, well, I can say that it's here in Portugal, but at least where we are developing this work, the focus is still very oriented to these objective measures, both at the person level, but more difficult to change, I would say, it's at the system level, and all the indicators around the processes, and focusing on the systems. So starting where we document the interactions and the things that are relevant for the person and for the practitioner, right? Because these are two persons that need to be accounted for. And then afterwards, the system, the informatic system that allows the communication, and even the macro system where we get the information, these indicators that are so important, and that Hannah certainly has something to say about from the economical point of view. So I think, yeah, so my reflection goes into this whole system approach and the challenges of actually, just investing in not in the economical way, putting everyone's thought in this, aligned with this whole systems approach. And where do we start to change, so that on one hand we have the practitioners flourishing, because I think that's really where we have to start, because we are not happy with what we are doing. So having an intervention where the practitioner, the person who is delivering the intervention, is also happy and feeling that he's doing it in a meaningful way, as Tanya put it forward so nicely and so meaningfully. And on the same level, how do we bring the person on the other side to be a person? We are still teaching things like paying attention to the needs and values, and we are always thinking about the needs, but the person has resources. And how often do we talk about the resources of that person? How often do we think, how often do we hear the story from the beginning to the end, not that nausea or, that temperature that it's high, but how those symptoms actually impact the fact that the person cannot take the daughter or the son to the school in the morning. That would be the meaningful part. So this is just I don't think I have a question, just a reflection. And I think that's really the big challenge, to put everyone to think in the same line.
Thank you. Normally I would then pass it on to the person most familiar with the idea of reflecting about stuff, and that would be Christopher. But I know that we're kind of tight for time, and I don't want to take the next speaker's time away. But maybe I could invite Tanya to wrap up this part of the section. Invite everyone to put any thoughts, any comments, any questions, throw them, not literally, throw them into the chat space, and they may be picked up during the day, or go to the Padlet and put some stuff in there. And Chris, I'm sure you'll elaborate on this when you come back to speak to us later in the day. But I'll just give it off to Tanya at the moment to round us off.
Thank you very much, Sean. And I suppose my reflection is this: let's not go down a rabbit hole of interventions. I know I mentioned interventions, but actually interventions in the context of culture is everything. So it's multiple. Again, it comes back to that complexity. So I think specific interventions are good, but we've not got to take our eye off the ball around workplace culture, and that brings its own challenge. So I'd like to thank Mariah and Webb for bringing that perspective, to bringing a big, more global perspective into the space. And actually, it's challenged me to think, and you forget, I mean, I've done some work with the framework in Nigeria in a really underprivileged healthcare environment. I suppose the one thing I want to say is, at a level, it resonated. I mean, I've also done some work with some colleagues in Kurdistan. So I think we've a lot more work to do, but I think at a level of principle, it works. So thank you for giving me your time and for listening. And I hope I've set the tone for the rest of the day. And I hope people will continue to engage with different elements of what we've talked about this morning in relation to the other presentations as we go through the day. So just wanted to say thank you very much for your time and attention. And I will be here throughout the day and happy to continue some of those conversations. Thanks, Sean.